slightly at a higher risk for developing back pain, especially due to osteoporosis and during pregnancy. Obesity, overweight may lead to excess load on spine. History of any back injury may produce recurrent of back pain. Poor posture, especially sitting, standing, incorrect posture for a long period may produce back pain. Improper lifting techniques such as bending at waist, sudden jerks may produce disc prolapse and back pain. Smoking, it reduces the blood flow to spine, delays the healing and may produce increased back pain. Psychological factors such as anxiety, depression, stress, they may increase add on to the back pain. Pregnancy, mainly due to hormone changes and altered posture, may lead to increased stress in the lumbar spine. So, what are the causes of back pain? This is a small chart representing different causes of back pain. So, most common causes of back pain is mechanical. That is more than 90% of the patient. This is mainly due to the overstrain, improper lifestyle, and back strain, which can be preventable. Okay, so the other causes which are of concerns are pain related to disc problem or spinal stenosis. This may mainly present with back pain, with leg pain or sciatica or other neurological symptoms. The other causes are inflammatory conditions such as rheumatoid arthritis or seronegative spondyloarthropathy or ankylosing spondylitis. Injuries, that is history of any trauma, fractures. The back pain may be associated with certain other tumor related conditions such as tumors spreading to the spine, cancers and metastasis. The bone disease such as vitamin D deficiency. This may produce overall back pain, resting pain. The failed back syndrome mainly seen in patients with previous history of any spine surgery with recurrence of symptoms. Osteoporosis, mainly seen in the old ladies, usually the females, mainly after the menopause, mainly due to the decreased bone density. So, what are the common causes of back pain? These are the common, this is the brief graphical representation. Poor posture, improper lifting of weight, strong physical activity lead to excessive strain over the spine. Stress and anxiety adds upon obesity and injury to the back. So common causes of back pain are herniated disc. This is due to ruptured disc which pinches upon the nerve causing the discomfort. Back injury mainly due to accidents, falls and strain can lead to pain. Spinal stenosis, that is a shrinking of spinal canal, puts pressure on the spinal cord mainly due to leg pain while walking. Osteoarthritis of the spine due to bone spurs and stiffness affects spine stability. Soft tissue strains, repetitive movements, or sudden exertion damages ligaments and muscles. Deformities such as scoliosis, osteoporosis in old age, post-laminectomy syndrome, spondylolisthesis, that is slippage of one vertebra over the other. This may produce back pain with leg pain. Myofascial pain syndrome may produce chronic muscle tightness eased by therapy. Sacroiliac joint insufficiency may also produce back pain. Okay, so this is the causes of low back pain, mechanical and non-mechanical, that we have already mentioned previously. Okay, so mainly I will be speaking about the disc prolapse. Okay, condition affecting the spine occurs when outer fibrous rings of an intervertebral disc tears. What happened when there is a tear in the outer annulus? The soft jelly-like nucleus pulposus bulges out and it presses upon the nerves or the spinal cord, producing the sciatica, weakness, numbness, and difficulty in walking or standing, etc. Okay. The common sites are lumbar and cervical spine. So this is a diagram image showing the section anatomy of disc and the nerve. So this is the soft jelly-like nucleus pulposus and which is surrounded by an annulus fibrosis. It is a little bit tougher thing. So what happened in disc prolapse? This soft tissue, this bulges out and goes posteriorly, and this is the spinal cord and the nerves. So when it pinches or compresses the nerves, it produces leg pain, sciatic or weakness in one leg or bilateral legs. So this is the disc jelly leg tissue which is being herniated and which compresses the nerves and produces symptoms. Okay. So this is a diagram showing the normal disc. See, we can see the wide disc, maintained height, When this disc is degenerated, the disc height will decrease and will produce disc bulging. See, backward we can see a small bulge in the disc, and when it extends posteriorly, it may compress the nerves and may produce symptoms. Stages of disc prolapse includes stage of degeneration, that is, there is a loss of fluid in nucleus pulposus. This lead to protrusion. We can see a small bulge, this prolapse, and then extrusion when this things comes out of the outer ring, and sequestration when this disc fragments is inside the spinal canal. So, what are the symptoms of disc related problems? That is, disc prolapse or canal stenosis. Mainly present with low back ache, leg pain, numbness, heaviness, difficulty in walking, weakness, bowel bladder involvement, and sometimes walking the patient, we get a side tilt called the sciatic scoliosis. Okay. So, how to prevent? Mainly, we are talking about prevention of this back pain. So, how to prevent this back pain or disc related issues? The main thing is lifestyle modification and ergonomic adjustment. This is the main thing we have to follow so that we don't get a back pain or we don't go in for the disc prolapse. Maintain a healthy weight. Okay. Do regular exercise and improve your posture to avoid back strain and strain on the disc. The ergonomic adjustments is the adjustment at our workspace. Use a supportive chair and take a frequent break to stretch and move around in between the work. While lifting and bending, lift correctly. Okay, I will show in the for coming slides how to lift. Avoid twisting while taking the lift. It may increase the strain on the disc. Use proper lifting techniques. Okay. Stress reduction. Manage stress by relaxation. Practice relaxation techniques and get enough sleep. Additional tips to prevent the back pain are stretch regularly, engage in regular stretching exercises to improve flexibility, strengthen your core muscles. Weak core muscles can contribute to back pain. Consider physical therapy. If you are experiencing chronic back pain, consider consulting a doctor. So this posture, this is the thing we have to maintain. Middle one, we can see the normal posture. This posture will reduce the strain on the disc or other joints. See, it should be like this. The head should be in line with the shoulder. It should be passing through the hip joint and through the knee joint and angle. Any deviation from this line, it may produce undue stress in back, neck, knee joint, producing arthritis at that particular point. Okay. So this is the types of posture healthy. These are the various postures we can see. Don't have to means normally it should be healthy posture should be like this. Other postures are not good. It should be avoided. Posture at work. See, when we are working with the improper posture, this is the posture related. See how bad the posture is. It may produce undue stress on the neck, this back, this hip joint, this elbow joint, this knee joint. So it should be avoided. So work better. This is the work better. We have to ensure that the while sitting, we should sit with a proper backrest. Align your monitor with the eye level. Okay. Sit with proper foot rest and avoid sitting for a very long period. See, idle posture. These are all idle posture to prevent the strain over the back and neck. This should can be see back support, proper upper back support. Okay, maintaining the alignment of the spine. See, like this, it should be properly maintained at the work site. While lifting, we see the proper lifting technique is while lifting a weight, we should bend our knees and lift rather than flexing the hip and extending the knee. The first one is incorrect. This should be the proper posture while lifting a weight to avoid stress on the back. We should do a regular exercises, stretching your muscles. Helps to reduce compressive forces on the spine, alleviating pain and discomfort associated with conditions like herniated disc, spinal stenosis, and degenerative disc disease. Regular exercise, these are all back exercises, should be done routinely, whichever it is comfortable, so that core strengthening muscles get strengthened. The other thing, while working on the phone, see, it should be avoided. That is, while we are texting messages or looking onto the phone, it should be in properly. That is, it should be in an head should be neutral position and should be lifted position rather than we flex the head. Okay. Exercises for the disc prolapse, we can do side planks, core strengthening, partial curls, prone SLR, and back extension strengthening. Now another thing is the position while sleeping. So how to sleep? Okay, when we are sleeping in a straight position, we should use a slow, thin pillow, and knee should be flexed by using a pillow under the knee. While we are sleeping in the side position, the pillow head should be adjusted so that the head is neutral. The knee should be flexed and a pillow is kept in between the legs. Mainly, it is a fetal position. It will also relax the back. Some people will be lying down in a prone position. So, in this condition, we can use a pillow under the hip to have a relaxation at the back. So these are all the preventive techniques that should be followed to avoid getting a back pain and to maintain a healthy back. Okay. So once we have the back pain which is not being relieved, we have to diagnose it. We can take either an X-ray or MRI to confirm what is the condition which is causing the back pain. Okay. So depending upon the cause, the treatment can be either pharmacological, which includes analgesics, anti-inflammatory, steroids, etc. And non-pharmacological therapy includes patient education, that is mainly is the lifestyle modification, proper posture, exercise therapy, massage therapy, spinal manipulation, cognitive behavior therapy, progressive relaxation technique. Okay. So one mostly more than 95% of the patient will be benefited with conservative non-surgical management for this disc related problem or back pain. So, sir, less than 3-4% of the patient which are not having relief may need surgical interventions. Surgery nowadays it can be either minimal or open procedures. So surgical, I told it can be either open or keyhole surgeries. Nowadays everyone is preferring the keyhole procedures with latest development of equipments. So just briefly showing the image, this is a image in which discectomy is performed by various methods. The first image we can see a big incision, lot of muscle dissected, tissue dissected. This is an open discectomy, so more tissue damage is being done. Second is a tubular discectomy. Incision size is decreased, muscle damage is decreased. Third, we can see a microscopic still damage is decreased. And the last one is the endoscopic discectomy, which we do. The incision is about 5 to 8 millimeter. So it is the least invasive procedure causing least damage to the muscles and other soft tissues. For this, we require special equipments. See, these are the special equipments to perform the endoscopic keyhole discectomy and decompression procedures. So, what are the advantages of these keyhole procedures? It can be done as a daycare procedure. It can be done under local or GA, smaller, less than 6 to 8 millimeter scar, minimal blood loss, only pathological disc fragment is removed. On table relief of the symptoms can be assessed, early return to work, and patient satisfaction. And finally, just we'll show the few cases. See, we can see this is a MRI with this black thing is the disc prolapse. We can see a huge disc, 35-year lady, such a huge disc. She was having so much symptom. So such a big disc, the permanent solution would be surgical. See, we can see a small incision through which we have removed this disc pathological disc fragment. This is the endoscopic view of the pathological disc prolapse. This is the disc removed. We can see the endoscopic view. This is the root after discectomy is completely free. Another case, a huge disc L3, L4, L4, L5. See the incision size through which we are removing this disc fragment. A very small disc incision. Almost no surgical scar can be seen in the follow-up. Another case, alpha S1 disc prolapse, same we can see done through a single incision, small stapler only. Other options, other treatment which we can do are endoscopic stabilization or fusion procedures. See, this is a L4 L5 unstable thing. We have done a percutaneous keyhole fixation followed by percutaneous transcambien fusion with expandable cage. See, the disc height is being restored with an expandable cage. Other surgical procedures which can be done are minimal invasive stabilization. Here, X-ray shows a spondylolisthesis, which is slippage of one vertebra over the other. This can be treated with minimal invasive. We can see these screws are being placed percutaneously and cage is being introduced sideways. So muscle dissection is being limited. See, this is the image of a open same case. We can see lot of muscle being is damaged and bone is being resected. So this is being prevented in the keyhole surgeries and minimal invasive spine surgeries. Okay. So what are the procedures that can be done through the keyholes or endoscope are discectomy, lumbar canal stenosis, endoscopic fusion surgeries, spondylodiscitis, as well as tumor surgeries. Thank you.